Breastfeeding is the natural way to feed your baby. It's how babies were designed to be fed. Your body creates breast milk, the perfect food for your baby's growth and development. Breast milk is full of important nutrients and antibodies. Antibodies help your baby fight off infections. Breastfeeding is a beautiful bonding experience. When you breastfeed, you hold your baby close. Your baby can feel your warmth and love. This skin-to-skin contact is calming for both of you. Breastfeeding is a learned skill. It takes time and practice for you and your baby to get it right. Don't worry, you can do it. There are many resources to help you succeed. If you are struggling, ask your doctor or a lactation consultant for help. Lactation consultants are experts in breastfeeding. They can provide guidance and support. Breast milk is nature's perfect first food, uniquely designed for your baby's needs. It's a powerhouse of nutrients and antibodies that support your baby's healthy growth and development. One of the most significant benefits is its ability to boost your baby's immune system. Breast milk contains antibodies that act like tiny warriors, fighting off infections and keeping your baby healthy, especially in the early months. Breast milk also promotes optimal digestion. It contains prebiotics that encourage the growth of healthy bacteria in your baby's gut, reducing gas, constipation, and diarrhea. This contributes to a happy and comfortable tummy for your little one. Moreover, studies have shown that babies who are breastfed have a lower risk of developing certain health conditions later in life, such as obesity, type 2 diabetes, and some childhood cancers. Breastfeeding isn't just beneficial for your baby, it offers numerous health advantages for mothers as well. It's a win-win situation for both of you. One of the immediate benefits is its role in postpartum recovery. When you breastfeed, your body releases hormones like oxytocin, which helps your uterus contract back to its normal size, reducing bleeding after delivery. Breastfeeding can also be a valuable tool for managing your weight. Producing breast milk requires extra calories, which can help you shed those pregnancy pounds more easily. It's like a natural workout for your body. Furthermore, breastfeeding has been linked to a lower risk of developing certain health conditions in mothers, including breast cancer, ovarian cancer, and type 2 diabetes. It's nature's way of taking care of you while you care for your little one. Section 4. Overcoming common hurdles. Breastfeeding, like any new skill, can come with its share of challenges. But fear not, most breastfeeding problems are common and can be overcome with the right information and support. One common concern is sore nipples. Proper latching techniques are crucial to prevent nipple soreness. Ensure your baby is latching onto a good portion of your areola, not just the nipple. If you experience pain, don't hesitate to seek help from a lactation consultant. Engorgement, when your breasts become overly full and uncomfortable, is another common issue. Frequent feeding and proper latching can help prevent engorgement. Applying warm compresses or taking a warm shower before breastfeeding can encourage milk flow and relieve discomfort. Milk supply concerns are also frequent among breastfeeding mothers. Remember, your milk supply works on a supply and demand basis. The more you breastfeed or pump, the more milk your body produces. Stay hydrated, eat a balanced diet, and get plenty of rest to support healthy milk production. Section 5. Latching onto success. Getting a good latch is essential for successful breastfeeding. When your baby latches correctly, they can effectively extract milk, preventing nipple soreness and ensuring they get enough to eat. First, position your baby comfortably close to you, tummy to tummy. Support your breast with your hand, using a C-hold or U-hold to guide it toward your baby's mouth. Next, tickle your baby's upper lip with your nipple to encourage them to open wide, like a yawn. When their mouth is open wide, bring them quickly to your breast, aiming your nipple towards the roof of their mouth. A good latch should feel comfortable and pain-free. Your baby's chin should be touching your breast, and their lips should be flanged out like a fish. If you experience pain, gently break the suction with your finger and try again. Section 6. Tech to the rescue. In today's digital age, technology plays a supportive role in the breastfeeding journey, offering convenient resources and assistance at your fingertips. Numerous breastfeeding apps are available, providing a wealth of information and tools to help you along the way. These apps can help you track feeding times, diaper changes, and even offer personalized tips and reminders. Online breastfeeding communities and forums are invaluable resources, connecting you with other breastfeeding mothers who understand the joys and challenges of this journey. Sharing experiences and seeking advice from others can be incredibly empowering and supportive. Telehealth services have made it easier than ever to connect with lactation consultants virtually. Through video calls or online chats, you can receive personalized guidance and support from the comfort of your own home. Section 7. Embrace the journey. Breastfeeding is a beautiful and rewarding experience, but it's also a journey that requires patience, practice, and self-compassion. Remember, you are not alone on this journey. Seek support from your partner, family, friends, and healthcare providers. Don't hesitate to ask for help when you need it. Remember, every breastfeeding journey is unique, and there is no right or wrong way to do it. Trust your body and your baby. Your body was designed to nourish your little one, and your baby was born with the instinct to breastfeed. Embrace the challenges and celebrate the victories along the way. Most importantly, enjoy the special bond you are creating with your baby through breastfeeding. These early moments of closeness and connection are priceless and will be cherished for a lifetime.